So I'm the on-call doctor this weekend, and I just got a phone call about a patient that was out trimming trees and got a big scratch on her right eye. So working on some cedar trees, cleaning them up, and took a scratch to that right eye. She took some allergy meds last night. It started feeling better, so she went to sleep. This morning she wakes up, it's way worse, and now I'm heading to the clinic to take a look at her. So in this video, I'm gonna walk you through exactly what I'm asking that patient, what I'm thinking, and what we want to worry about and watch out for. So first thing that we want to know is I've got some questions that I'm going to ask. So I want to know, are we in pain? Are we light sensitive? Is the vision blurry? And so the answer to those questions is more than likely going to be yes. So if that abrasion is in the dead center of the vision, it's going to make sense. That epithelium is scratched, so it's not organized, it's not really cleaned up tissue, so it's not going to be the clearest image. The cornea, good news is one of the fastest healing parts of the body. Bad news is if there's a lot of inflammation around it, it doesn't heal the most efficiently. And so I'm going to find out, was it all the way better last night and then way worse this morning? The pain, cornea's got a lot of nerves there. And so going to be in pain. That is also going to make us light sensitive. So for an abrasion, this is all perfectly normal, exactly what I would expect to hear. So when I get there, I'm going to take a look in what I don't want to see. I don't want to see that abrasion looking like a triangle with the point of it down towards the bottom and it wider up at the top. The reason why is what can sometimes happen is when we blink, we'll catch that little point and rip that abrasion a little bit bigger. And so we're just making that base bigger and bigger and bigger with every blink. That is what I don't want to see. If I see that, I'm going to debride her cornea. Basically what I'm going to do is I'm going to go in and I'm going to clip off that top and I'm going to kind of blunt it off, almost round it off a little bit, just so that every time she's blinking, it's a nice smooth situation. Now I'm going to find out if she wears contact lenses, because if we wear contact lenses, I'm not going to put a bandaged contact lens on her. If she doesn't normally wear contact lenses, then I'm going to put a bandaged contact lens on there. It's going to basically just act like a little bit of a buffer. It's going to help protect that new cornea so it can heal a little bit better. It's also going to keep the wind away from that because that's where the pain's coming from. So I'm going to put a bandaged contact lens on her if she's not a contact lens wearer. And then I'm also going to start her on a steroid combination drop. So the steroid's there to calm down inflammation. And so if we have a lot of smoldering inflammation going on, then the body won't heal properly. That epithelium won't tack down like it's supposed to. So I want to make sure that there's not a lot of inflammation in the area. So that's where the steroid's going to come into play. I'm also going to do an antibiotic. The reason why is I don't want an infection happening. She doesn't have one right now. I'm going to make sure she doesn't end up getting one. So I'm going to put on a steroid antibiotic combination drop just to calm things down a little bit. Then I'm also going to have her start some artificial tears. Please do not do the get the red out type drops. Those will actually just mimic and hide things. It'll mimic a healthy eye. It won't let us actually know if things are healing like they're supposed to be. And so I'm going to tell her to stay away from the get the red out type drops, but instead I'm going to have her use some drops that have either mineral oil in them or maybe some glycerin, something along those lines, just because I want a little bit more oily consistency in that area. I want that little lubrication to help protect it so it can heal a little bit better. Vitamin C. I'm going to encourage her to drink some more orange juice, take some more vitamin C. That'll also help that cornea to heal a little bit faster, a little bit more efficiently. So essentially there's two things that we worry about in these situations. So one is recurrent corneal erosions. And so what happens is if we don't get proper treatment, that epithelium doesn't tack down like it's supposed to. So lo and behold, we end up having this smoldering inflammation that's sitting there, epithelium doesn't tack down. So what'll happen is she'll go to sleep, a spot on the upper eyelid will get dry, it'll tack down, get sticky to that cornea, and first thing in the morning, she's gonna open that eye and it's gonna rip that cornea back loose, and we're gonna have basically an abrasion just rehappen. It's recurrent corneal erosion. So that's kind of worst case scenario. The other thing is a fungal infection. Do not want a fungal infection. And that is what we worry about whenever we have vegetative matter, a tree branch, a piece of grass, whatever, hit the eye and cause an abrasion. I won't know if there's a fungal infection for a week, 10 days, maybe a couple of months. And so the thing I'm going to let her know is that after I get this all cleaned up, we're doing a whole lot better. If all of a sudden 3 or 4 days down the road, 3 or 4 weeks down the road, we're suddenly in a lot of pain or we're suddenly having some vision loss, do not pass go, do not collect $200. come right in, let me take a look at it, make sure we don't have a fungal infection going on. Because if it is a fungal infection, that's a pretty big deal. And we're gonna basically become on a first name basis, because I'm gonna be coming up to the clinic on a regular basis. She's gonna be coming up to the clinic on a regular basis for us to take care of this and get this cleaned up and get this fixed up. And so do not want that scenario. If it is looking really good, everything's happy, I may put like an amniotic membrane, a high-grade tissue, dehydrated membrane on this to help it heal up a little bit quicker, depending on how well it's going. Something we get looked at today, and then I'll probably see her back in a few days, maybe a week, check on it. And if we're having no issues at 2 months, we're probably in the clear for everything going good.